You mentioned wanting to come back to toxins impacting the enamel. I'll have you get into that.
Yeah, absolutely. So something that it quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic, and not many are speaking about it, although I do have colleagues in other countries noticing it too. Is something called enamel hypoplasia, or it's basically undermineralized enamel. And so I'm seeing more and more children, their teeth erupt. They're already deficient. You can just tell by the way the enamel looks, the way the light shines off it. It will be mottled, chalky, breaking, crumbling. And I've seen a very significant uptick in this in my past 2 decades of practice. This is observational. There's some data to support it. Unfortunately, we don't have enough data. So why would that be? Well, chronic vitamin D deficiency on a global level, chronic mineral deficiency on a global level, but also there's studies now showing microplastics are affecting enamel formation. So microplastics are endocrine disruptors. Amelogenesis or enamel formation is a hormone-driven process. And so it very well could be that microplastics are contributing to this epidemic. I believe that it is. And it gets very overwhelming when I speak to parents about this because what can we do? I mean, we can only minimize our exposure. It will never be zero. I saw Dr. Huberman's done a lot on this in the past few weeks, saying best ways to avoid microplastics: don't drink out of plastic bottles, don't touch receipts, because receipts are covered in like a BPA, believe it or not, and it's absorbed through your skin very easily. And don't store food or microwave food or heat up food in plastic. Like if you can just do those, it's a huge win. But also, there's microplastics in a lot of our products that we're using and our clothing. And so again, it gets overwhelming. I like to share this only with parents because I think so many of us, including for our own selves, we feel guilt and shame if our teeth get decayed, if we have gum disease. Every time we go into the dentist, there's an issue, like we internalize that, we think it's something we've done wrong. But I will tell you, I'm seeing this in my practice. It's bigger than us. This is a deficiency issue. This is a toxin in the environment issue. I also see children and adults who've been exposed to lead or mercury poisoning or mycotoxins. They have so many dental issues. And again, it's because it's impairing immune function, it's impairing salivary flow, it's impairing how we absorb and utilize our nutrients and our minerals and our vitamins too. And those mycotoxins can be interacting negatively with our commensal bacteria also. So I just think it's important to share that to everyone. Like, try not to feel shame. Unfortunately, I think some dentists contribute to that. It's like, well, you must be eating this or you must not be doing that. And I think it's a paradigm shift. We need to look a little bit bigger at what some of these issues are and realize that so many are out of our control. And then once we identify the factors, like how can we best support our patients to optimize and course correct?
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Something that quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. Is something called enamel hypoplasia, or it's basically undermineralized enamel.